Good afternoon. My name is Karina Gilmore, and I'm a registered nurse. The topic for this month will be pacemakers and implantable cardioverter defibrillators. You are required to take a quiz after the completion of this course. The heart. The heart is about the size of a fist. It is made up of 4 chambers: the right atrium, the left atrium, the right ventricle, and the left ventricle. Valves that allow the blood to flow in only one direction separate the chambers. The blood from the body enters the right atrium and passes into the right ventricle. As the heart beats, the blood flows the lungs where oxygen is added. From the lungs, it returns to the left atrium and passes into the left ventricle. The beat of the heart then pushes the blood into the body, where it delivers nourishment and oxygen, and picks up carbon dioxide and waste from the cells. You learned in your home health aid class that the pulse reflects how fast the heart is beating. Normally, the heart beats between 60 and 80 beats per minute. To beat efficiently, the different parts of the heart must contract in a precise order. For this to occur, the heart needs continuous, regular stimulation. This stimulation is provided by electrical impulses from the heart's own pacemaker, called the sinoatrial node, also known as the SA node. These signals are carried partly by the heart muscle and partly by specialized nerve fibers. The signal originates in the right atrium and then spreads to all 4 chambers. Key terms to add to your understanding. Atria is the upper chambers of the heart. AV node, the junction between the atrium and the ventricles. Dysrhythmia is an abnormal heart rhythm caused by an electrical disturbance in the heart muscle. Fixed rate pacemaker sends a steady electrical signal even when the heart is beating normally. Heart block, a condition caused by an interruption of the electrical signals as they attempt to spread throughout the heart. A pacemaker is needed to treat severe forms of this condition. Holter monitor is a special battery-operated diagnostic device that a patient wears at home to document heart activity for 24 hours. Long QT syndrome is a very serious condition that occurs when the heart's electrical system is recharging abnormally. Pacemaker is an implanted device that sends an electrical signal to the heart when the heart's natural pacemaker and the SA node is not functioning properly. Sick sinus syndrome is a condition in which the heart's own pacemaker does not function normally. SA node is an area in the right atrium that serves as the usual pacemaker for the heart. Ventricles are the lower chambers of the heart. Ventricular fibrillation is cardiac arrest. Quivering, disorganized electrical activity within the heart of the ventricles that cannot sustain life. Defibrillation is the only effective treatment for this condition. Ventricular tachycardia, a serious dysrhythmia that causes the ventricles to beat 150 to 250 beats per minute. Decreasing cardiac output. If not reversed quickly, the patient may lose consciousness and become pulseless. It may progress to ventricular fibrillation. It usually responds to defibrillation. Heart rate disorders. Dysrhythmias are abnormal heart rhythms caused by an electrical disturbance in the heart muscle. An older term you may hear to refer to these electrical disturbances is arrhythmias. Both terms stem from Latin, but dysrhythmia is normally technically correct because it means difficult rhythm. Arrhythmia translates to absence of rhythm. The goal of implanted cardiac devices is to correct electrical disturbances and result in abnormal heart rhythms. 2 common causes of dysrhythmias that lead to implantation of a pacemaker are heart block and sick sinus syndrome. Heart block. Heart block is a disorder that may cause dizziness, fainting, or strokes. It can also result in seizures. It is the most severe form of heart block, and it can also be fatal. Heart block is caused by an interruption of the electrical signals as they attempt to spread throughout the heart. There are several levels of heart block. In its minor form, there is a slowing of the signals. However, the person experiences no symptoms at all. Any area of the heart can act as a pacemaker. The SA node fires rapidly, so there is no need for other areas of the heart to initiate the cardiac impulses. Other tissues may initiate pacing if the number of impulses generated by the SA node falls below 50 beats per minute. Approximate heart rates for each area are: atria should be 60 to 100 beats per minute, AV junction 40 to 60 beats per minute, ventricles 20 to 40 beats per minute. When a person has heart block, he or she has an accumulation of scar tissue in the AV nodes. This is the junction between the atrium and the ventricles. Impulses must pass through this area on the way to the ventricles. Any interruption or delay in the path of the impulses causes rhythm disturbances. In heart block, the scar tissue prevents some or all of the impulses from passing through the AV node or the ventricles. Heart block is more severe when some of the signals do not reach the ventricles and the heartbeat becomes irregular. Sometimes only 1/2 to 1/4 of the signals arrive to the ventricles. In its most severe form, the electrical signals do not reach the ventricles at all. The ventricles continue to beat, but not in unison, with the signals being sent from the SA node. When this occurs, the atrium may be beating at 60 to 80 beats per minute, while the ventricles are beating at 40 beats per minute. Dysrhythmias of the ventricles are always very serious and or fatal. In about half of the cases of heart block, the cause is unknown. Often, however, it is related to a heart attack or a rheumatic fever. Heart block can also result from an overdose of the frequently prescribed drug digitalis. Drug and drug alternative products can also cause heart block. Long QT syndrome. In the past few years, a great deal of attention has been paid to a condition called long QT syndrome. This is a very serious condition that occurs when the heart's electrical system recharges abnormally. The condition may be congenital or acquired. People with congenital LQTs are prone to go into ventricular fibrillation, cardiac arrest, which is due to certain external stimuli. We have learned that several very popular antibiotics can also cause LQTs. In fact, many prescription drugs, some street drugs, and some abnormal laboratory values may also cause the syndrome. Sudden death will occur if the problem is not identified and treated. The congenital form is usually treated with drugs. This condition may also be treated with a pacemaker and a defibrillator. Unfortunately, the condition must be diagnosed early. It is often asymptomatic, and the first sign of a problem may be sudden death. Ventricular fibrillation is a quivering, disorganized electrical activity of the ventricles that cannot sustain life. The person will die if it is not reversed quickly. Defibrillation is the only effective treatment for this. List of drugs with the potential to prolong the QT intervals are available at www.credibolmeds.com. Sick sinus syndrome. In sick sinus syndrome, the heart's own pacemaker does not function normally. It signals the heart to beat very slowly, or very slowly alternating with a very fast rate. In some instances, it stops signals completely. The symptoms include dizziness, fainting, and sometimes palpitations. A diagnostic tool called a Holter monitor is used to confirm this diagnosis. To use a Holter monitor, electrodes are attached to the patient's chest. A special battery-operated monitor or recorder documents heart activity for 24 hours. The patient must keep a written diary listing times, daily activities, symptoms, problems, and emotions during this time. The most common cause of sick sinus syndrome is coronary artery disease. When the heart block or sick sinus syndrome causes this heart rate to become irregular, too fast, or too slow, the treatment is usually the implantation of a pacemaker. Other conditions are also treated with pacemakers, but the problems identified here are among the most common. Pacemakers. Artificial pacemakers were first developed in the 1930s. However, their use was very limited. In the 1950s and 1960s, they were further refined. For a period of time, external pacemakers were used, but infections along the wires leading to the heart were common. Today, external pacemakers are used only as a temporary measure. Patients who are discharged from the hospital with a pacemaker have the permanent type. Persons with external temporary pacemakers require hospital care. The first pacemaker was implanted in 1958. Since that time, pacemakers have been significantly reduced in size and are able to perform more functions. They are also made to last longer, require fewer replacements, and are more resistant to outside electrical disturbances. Today's pacemakers weighs an ounce or less and must be replaced every 6 to 10 years to prevent battery failure. The frequency depends on the type of battery in the unit. Externally charged batteries may also be used in some units. The batteries do not fail suddenly. The handheld computer that the physician uses to check the device will give a low battery warning and or a replacement date. A pacemaker is an implanted device that sends an electrical signal to the heart when the heart's natural pacemaker is not functioning properly. A pacemaker has two parts. One part is the battery power generator. The second part are wires called leads that connects the generator to the heart. The pacemaker normalizes the heart rate by transmitting the electrical activity that occurs in the heart to the pacemaker generator. The generator responds by sending a tiny signal to the heart to initiate a beat. This is called pacing. You will see two main types of pacemakers in home health care: demand pacemakers and fixed-rate pacemakers. The only majority of pacemakers are the demand type. The demand pacemaker sends an electrical signal to the heart only when the heart rate slows below a certain level or misses a beat. As long as the heart rate and beat are normal, an indicator is sent to the pacemaker to stop its signal. The fixed-rate pacemaker sends a steady electrical signal even when the heart is beating normally. Implantation. Most pacemakers have an insulated wire that is inserted into a vein into the neck. The end is attached within the area of the heart muscle that requires stimulation. The case holding the battery is fitted into a surgically created pocket under the skin of the chest wall, near the clavicle. The implantation procedure is performed under local anesthesia and requires only about an hour to complete. Modern pacemakers can be programmed and reprogrammed from outside of the body. Today's pacemakers can be set to respond to each patient's individual needs. Newer pacemakers can monitor blood temperature, respiratory rate, and other factors. The device adjusts the heart rate to change in the internal environment and patient activity. They can even be checked by telephone from home using special equipment. Routine telephone checks are done every 2 to 4 months for the first 3 years and every month after that. After implantation, the physician checks the patient in 3 months and every 3 to 6 months thereafter. If the original symptoms return or the person suddenly shows severe or extended hiccups, dyspnea, severe dizziness, fainting, fatigue, edema, or muscle twitching, the pacemaker must be checked right away. It can be reprogrammed with an external wand if a problem develops. The implantable cardioverter defibrillator. Ventricular dysrhythmias originate in the lower chambers of the heart. The ability to pump blood to the body is impaired when abnormal ventricular rhythms occur. These rhythms must be reversed quickly or they will cause rapid loss of consciousness and sudden death. Reversal is usually done by means of delivering an electric shock with a defibrillator. An implantable cardioverter defibrillator, also called ICD, is surgically placed or implanted under the skin on the chest, below the collarbone. The abbreviation of this name is ICD. Wires extend from the heart to the monitor and sense heart activity. When a life-threatening ventricular rhythm occurs, the ICD delivers an impulse similar to a shock to reverse the disorganized cardiac activity and restore the normal rhythm. Newer ICDs can also be used as pacemakers. The first experimental ICDs were implanted in humans in 1980. At that time, many physicians were opposed to them and believed that they were unethical. Early devices were large, heavy, and required the surgeon to open the entire chest to implant the device. Over time, physicians learned that if patients who are high risk for dysrhythmias could be identified, the device could be an excellent treatment that actually saved many lives. A consensus was reached on the criteria for use, and these are listed below. Many years of human and animal trials followed. The device was modified many times. A small, lightweight, subcutaneous version of the device was finally approved by the Food and Drug Administration in 2012. It is now in widespread use throughout the world. To be a candidate for an ICD, a person must have experienced at least one cardiac arrest, due to a ventricular dysrhythmia, recurrent episodes of ventricular tachycardia, a structural heart disease with poor ventricular function, and a high risk for sudden cardiac death. Ventricular tachycardia is a very serious dysrhythmia caused by an irritable focus in the ventricle. It causes the ventricles to beat 150 to 250 beats per minute, decreasing cardiac output. If not reversed quickly, the patient may lose consciousness and become pulseless. It may progress to ventricular fibrillation. It usually responds to defibrillation. The patient always knows when a shock has been delivered. Some describe it as feeling a kick in the chest. If you are touching the patient when a shock is delivered, you will notice tension and muscular rigidity in the upper arms and chest. It is not painful and it will not harm you. Persons with ICDs are often aware of the onset of symptoms that will result in a shock. If this occurs, have the person to stop all activity and assume a comfortable position. Observe and inform the nurse of what the person was doing before the shock was delivered, any signs and symptoms, and the person's response to shock. Check the vital signs after the shock if possible. The patient is instructed to report ICD activity to the physician promptly. If the unit discharges repeatedly or the person is symptomatic, immediate physician assessment is needed. The unit records the rhythm and the type of shock delivered. Under normal circumstances, the person visits the physician every 3 to 4 months, so the doctor can check the stored information. The unit will deliver about 250 shocks before it must be replaced. The battery lasts about 3 to 6 months, depending on the number of shocks it delivers. Newer ICDs can be used as pacemakers as well. Care of pacemakers and ICDs. Since the 1960s, about 2 million people in the United States have had pacemakers implanted. There are many different models, so it is best to know the precautions required by the one your patient is using. New pacemakers have fewer precautions than the older models. ICDs are now in widespread use. Management is similar for both devices. Precautions following surgery. During the first few weeks following the implantation of replacement of an implant, pacemaker, or ICD, there are some precautions that should be followed, which include: keep the incision clean and dry for the first 3 days. Showers are permitted after 3 days, but pat the area dry. Do not rub. Do not lift the elbow of the arm on the operative side over the shoulder for 4 weeks. This type of movement puts too much strain on the wires for the generator. Do not allow the person to lift, push, or pull more than 10 pounds for 4 weeks. Driving is not permitted until permission is given by the physician. Measure the patient's pulse and weight every day as ordered by the physician. Report problems and suspected malfunctions to the nurse immediately. In addition to knowing the type of device in appropriate settings, the home health aide should have available the manufacturer's cards describing the implanted device model and a number to call in case there are questions about its care. Avoid pressure on the implanted device or in the vicinity of the implant, including the shoulder, arm, chest, and back. Avoid exertion on the clavicle, such as pulling the arm down toward the ribs, including lifting heavy items or weights with the arm on the ICD side. Do not use a transfer belt if the device is implanted in the patient's abdomen, because there is a risk for fracturing the wires leading to the heart. Inform the dentist, physicians, therapists, and staff that the patient has an implanted device. Keep magnets and devices containing magnets at least 12 inches away from the implants. Defibrillators are safe with some magnets, but pacemakers are not. If in doubt, research the type of device and the source of magnetic energy. If the person complains of dizziness in the presence of a magnetic device, remove it from the area. Common household items containing magnets are magnetic medical devices such as bracelets, mattress pads, pillow covers, knee wraps, back supports, slippers, and shoe insoles. Keep these devices at least 12 inches away from the implant. The base charger and motor for the electrical, battery-operated, or ultrasonic toothbrush or plaque remover. Pagers, walkie-talkies, and other radio transmitters. Electric razors and blow dryers with an electrical cord. Handheld massagers, including massaging cushions inside of a chair. Avoid the anti-theft devices in stores, banks, and other secure areas. It is usually okay to walk through in an upright position, but do not stop in the middle or lean against the post. People in wheelchairs should find an alternate exit route. Remind the person to hold a cordless phone or cell phone in the right hand. The antenna must be 12 inches or more away from the implant. Stay away from large stereo speakers because they contain strong magnets. Keep scanning wands such as those used in airports at least 6 inches away from the implanted devices. Avoid power tools, welders, solder guns, drills, or gasoline-powered lawnmowers and or blowers, which may interfere with the implant function. Vacuum cleaners and other small household appliances are probably safe, but check for the manufacturer's instructions. One precaution that is no longer necessary for modern pacemakers is avoiding microwave ovens. The ultimate guide is the manufacturer's recommendations. Medical and diagnostic devices that must be avoided or require very specific safety precautions are magnetic resonance imaging, computerized axial tomography scans, diathermy, ultrasound, radiation therapy, transcutaneous electrical nerve stimulators, electrolysis, mechanical ventilators and some respiratory monitors, lithotripsy treatment for kidney stones. Things you want to observe and report. The home health aide spends more time with the patient than most other caregivers. Be alert for changes in your patient's condition. Inform the nurse promptly if the person has dyspnea, which is shortness of breath, dizziness, fainting or loss of consciousness, persistent weakness or faintness, or fatigue, chest pains or palpitations, frequent or persistent hiccups, edema of the legs, ankles, arms, and wrists. Medical identification. Persons with implanted medical devices are furnished with an identification card by the device manufacturer. The manufacturer's name and emergency phone numbers are listed on the card. Also listed are the names of the device, serial number, and manufacturer's lot and part numbers, and other identifying information. This is essential to have to determine whether the device is affected by a product recall, which sometimes happens. The person should carry the card at all times and provide a copy to all physicians involved in his or her care. The information on the card is useful in situations such as when an implanted device triggers a metal detector. Some physicians recommend that patients also obtain a medical alert bracelet listing implant information. Bracelets are preferred to necklaces. A copy of the card should also be sent to the funeral home if the patient dies. Case study. Your patient has a pacemaker that is set to fire only if the heart rate drops below 60 beats per minute. You visit for 2 hours 3 times a week. Your assignment says, check vital signs upon arrival and immediately prior to leaving. You want to think about, do you know the pulse represents 1 full minute? How will you check it? Will you check it for 15 seconds, 30 seconds, or 60 seconds? Upon your arrival, if the vital signs are 97.2, 48, 20 respirations, and blood pressure of 102/58, the patient appears fine. What would you do? What action would you take? Will you recheck the pulse? If yes, for how many seconds will you recheck the pulse? You will always recheck the pulse for 1 full minute. The patient seems fine and has denied having any symptoms. Will you call the nurse? You will call the nurse immediately. You will call the nurse for any symptoms that would occur with a defibrillator. Conclusion. The technology of pacemakers is improving to the point where they are coming close to imitating the heart's own signal system. Because of pacemakers, people are able to live normal, productive lives. Implanted devices to improve and correct heart functions are among the most common. Pacemakers have been used successfully for many years to treat heart rates that are too fast, too slow, or irregular. The ICD is a newer technology, but has proven successful in reducing the death rate. Both devices have improved longevity and enhanced the quality of patient lives. This concludes the lesson for today.